Are you suffering from sinusitis? Is there a permanent solution for that? Yes. Let's talk about sinusitis. Sinusitis, like the symptoms are similar to common cold, just that the symptoms might recur back again and again, or it might last unusually long for more than 7 days. So diagnosis of sinusitis is confirmed by doing two investigations. One is diagnostic nasal endoscopy, second is the CT scan. What is the cause to develop a sinusitis? It could be anatomical abnormalities in the nose and sinus. It could be the reasons related to the allergies and reduced immunity. What actually happens here is the normal mucus circulations from the sinus into the nose doesn't happen, gets blocked because of this inflammation, and the mucus accumulates inside the sinus, leading to infections, blockage of the outlet, and more problems further. What is the solution for sinusitis? Acute sinusitis and the mild initial stages of chronic sinusitis respond well to medical management, which we call it as maximal medical therapy. Whereas chronic sinusitis, which is of moderate and severe degree, and also where they have formed polyps, do not respond to medications well. What they need is a good surgical care to have a permanent solution. There is a belief among few patients that you do a surgery for the sinus, the problem is going to come back again after a few years and you'll have to repeat the surgery, which is completely false. How do you ensure that the sinus surgery will give you a permanent solution? We need to tick 4 boxes. First one is a complete diagnosis. There are multiple other problems associated with sinusitis. For example, the allergies, deviated nasal septum, and the turbinate problems, which has to be equally addressed to have a complete solution. We cannot expect to have one treatment, the sinus surgery, and all other problems to get solved. The second point is your surgical plan. Compared to a regular FES, surgeries like TFAC or a full house FES, these are the higher end surgeries, will give us a better success compared to a regular FES. The third thing is the technology used to do the surgery. The basic technology which has to be used is a microdebrider. The precision and the handling of the tissues is very good with a microdebrider. The tissue handling is good, recovery is faster and sooner. We can augment this by using something called as a balloon sinuplasty. The balloon is introduced into the sinus passages and inflated. The natural passage between the sinus and the nose is widened, allowing good circulation of mucus between the sinus and the nose. Third thing is you can include navigation technology, where the surgery becomes much more safer, reducing the complications of the surgery. The fourth and the final thing is the post-operative care and the patient compliance. It is equally important as the surgery is. We need to allow healing to happen in the right direction so that you get the ultimate benefit of the surgery. Post-operative care also includes medications, that is managing your allergies, having visits with your surgeon once in 6 months, or let's say once in a year, so that nothing goes wrong. So if you tick these 4 boxes, I don't see a reason why your sinus surgery has to fail. So the take home message are 2. Number 1, your common cold has to be treated in the right way. 10% of the population where the common cold is not treated well will end up in sinusitis. So it is important you take care of common cold well. Second thing, if you are already having a sinus issue, there is a complete surgical cure for that. In case you're neglecting your sinusitis symptoms, it can end up in multiple other complications like ear infections. It could even cause brain fever, or we call it as meningitis, or it can cause eye complications where there is a chance to lose vision, or if not, a long-standing lung infections can happen. So you don't have to suffer with this cold symptoms throughout the year. There is a solution for sinusitis. Meet your ENT surgeon today.